It is your Healthy Dose, Hannibal Regional Healthcare Systems, and we're talking today about something that pretty topical and actually something that not talked about as much as other health issues, at least from a local standpoint. We're talking to Dr. Ed Klein about foot pain and other issues related to that, and he joins Sean and I now. How are you today, Dr. Ed Klein?
Doing great. Thank you for having us.
Absolutely. And I know you guys have a lot coming up in the near future, a lot going on in June, foot pain screening coming up throughout the month. Talk to me about what these screenings are and why it's important to get one, maybe if you have pain, maybe even if you don't necessarily have noticeable pain.
So in the month of June, we've organized 4 different dates for free foot screenings where patients can come in for themselves or bring family members in for a free, absolutely no charge consultation and exam, answer questions about issues that they may be having. And the foot can be something that's or a problem with the foot can be directly related to the actual foot, or it can be associated with other diseases, with diabetes or rheumatoid arthritis, things like that. And it's not so much just the foot. It can be the shoe that you wear. It can be the activity that you want to participate in. It can be an injury that you've sustained if you're trying to start an exercise program. Say you want to train for the Hannibal Cannibal. All those sorts of things. We want to make sure that your feet stay healthy so that you have a solid base to start with.
And it's interesting, too, what you mentioned that, and this, I think this is something I've been told before. You mentioned the kind of shoes you wear. You could wear the wrong kind of shoes and put all that stress on. You mentioned the base. Can it lead to back problems a little bit, too?
Back problems, knee problems, hip problems. We classify the foot into three basic different types. There's a pronating foot, a supinating foot, and a neutral foot. And you can get a shoe that's designed specifically for your foot type to help support you and make you function at your best. Yeah,
not something you necessarily think about a lot, but I would say during the break we were talking about some local sports stuff that was going on this week. And I mean, I never thought about this back in the day, but for athletes, I bet a custom shoe could be very helpful.
It'd be, either a custom shoe or cleat or a custom insole to fit into that cleat. You can take a standard off-the-shelf athletic shoe and make it custom fit to that athlete just by providing them the stable footbed to put in there.
The summertime, plenty of different things to do. You got flip-flops, you got sandals, you got sneakers, you got bare feet. What are some of the special considerations that you're telling patients or things that they should look out for in the summertime?
That's a great question. Patients that have diabetes, we tell them that bare feet is an absolute no-no, and it doesn't matter if it's 90 degrees outside and you want to run your toes through the grass, or it's 10 degrees and you're in your snow boots. You've got to have shoes on at all times. And that's because that particular type of patient is more susceptible to injury, infection, and then the delayed or inability to heal. But for the most part, the person that doesn't have an issue that predisposes them to injury or problems, a well-fitting flip-flop or sandal is something that's acceptable. As long as it's something that's semi-supportive, that your foot will actually stay on or stay in, I'm okay with that. But you do get what you pay for. If you go to the store and buy a $4 pair of flip-flops, you're going to get about $3 worth of use out of it, and that's not going to help you. So to have the right shoe for the right reason is very important.
Absolutely, and when you do get the right kind of shoe, there's going to come a day when it wears out, and I think obviously that's got to be something that matters when a shoe's been worn so much that it's not that good for you anymore. How do you know when you've hit that point?
Well, I think that's a great question, because so many of us we keep our shoes in our closet or keep our shoes by the door, and we kick them off when we go in the house, and we slide back into them when we leave the house, and that's what we wear. And shoes do wear out just like anything else. So if you pay attention to the sole of the shoe or the tread pattern on the shoe, when it wears out, when it becomes slippery, particularly if you're in a line of work where you need that traction on the bottom of the boot or the shoe, when that wears out, you've got to get rid of it. You can't just slide it to the side and use that as your yard work shoe. You've got to have the right shoe, the well-fitting shoe, and the well-kept shoe to keep your foot healthy.
And it's not just athletes or people that like to walk, run, do whatever it is. People that work in, in industry, steel-toed boots, things like that. I mean, I know it's important You wouldn't think of steel-toed boots, they need to be comfortable, but it's probably absolutely important for
Well,
them.
certainly. If you think about how much time people that work in a factory setting in a steel-toed boot spend in that boot, they're 8 to 10 hours a day on the floor in the boot, and that's where their foot lives. So if it's not comfortable, if it doesn't fit right, they're susceptible to the same injuries and issues that an athlete would be, whether it's a blister or an infection or an irritation from something on the boot or the shoe that doesn't fit quite right. All of those things can adversely affect that patient and keep them from being able to do their job.
Yeah, very, very important. Talking about some other stuff here outside of these screenings, and we do want to mention June 8th in Hannibal, 11th in Canton, June 15th in Bowling Green, June 19th. That's in Shelbina and Monroe City. You're doing some screenings. And outside of that, though, what other services do you provide that people should know about?
We are a full-service, multi-specialty medical clinic or office. So we have the ability to see patients for injuries, for skin care, for nail care, for anything that's wrong from the ankle down to the tips of the toe. So it could be something as simple or basic as an ingrown toenail. It could be a heel spur. It could be a fracture or a sprain. It could be a bunion or a pinched nerve in the foot. All of these things, and anything attached or included in the foot, we take care of in the office, whether it's medical or surgical.
So they should contact you if they believe they have any of those things, or if I have a pain, it's like I got a pain today, but maybe not tomorrow. At what point should I call and check on this foot screening?
I think that's a great question. If you start with, okay, I'm sore today. Well, what happened yesterday that made me sore today? Did I start a new exercise program? Am I doing something different with my workout? Did I slip and fall down the stairs? If it's a day or two of soreness or irritation that you can relate to a recent injury or a recent activity, within a few days that should resolve itself and you should be back at full speed. If you last a week or so with the same soreness and it's not getting better regardless of what you've done, give us a call. Let us take a look at it, and we'll give you a full examination, consultation, and we'll take care of the problem and get you back on your way.
And now's the time with the free foot screening too.
And we can do that.
Yeah.
Absolutely.
And again, those dates, June 8th, 11th, 15th, and 19th, and they're Hannibal, Canton, Bowling Green, Shelbina, and Monroe City. So you got different locations, different dates. If people want more information on the screenings or they would like to make an appointment, what's the easiest way to do that?
Easiest way would be to call the office in Hannibal at 573-629-3500 and ask for the free foot screening appointment.
All right. So good stuff there. Good information. Get online for more information on the screenings. Call if you want to make an appointment. Dr. Ed Klein, our guest for our weekly Hannibal Regional Healthy Dose segment. Good information. Thank you for your time today.
Absolutely. Thanks for having us.